Okay, Mr. Doe, after looking at your results here and all the things that we've been talking about over the past few minutes, I think I've got a pretty good idea what's going on. It looks like you probably have what we call a radiculopathy at your L4 vertebrae. It sounds kind of scary, but it's really not that big a deal. Basically, the way that you've been moving and sitting is causing some irritation in one of the nerves that comes out of your spine. It's fairly common. It's relatively low threat and usually resolves relatively quickly with physical therapy. Kind of the way that we're gonna go ahead with this is we'll do some treatment here in clinic. I'll be pushing on your back. Some of my techs will be working with you, and we'll do some exercises. And then I'll send you home with a home exercise program that hopefully you can get after in your own time, probably twice a week, 3 times a week. And then you'll come back and see me once a week for the first month. After that, we'll cut you loose and see how you do with the home exercise program on your own for about a month, and we'll follow up, and then we can kind of see whether you're ready for discharge or whether we need to kind of refine our treatment. So the first thing that I'm going to have you do is part of what's called 4 for the core. Okay, and so what we're going to have you do is we're going to have you lay on your back, and then you're going to do what's called the draw in maneuver, where basically you try and bring your belly button all the way back to your spine. Okay, and you're going to poke yourself in the sides, and once you draw in, the sides right here should feel relatively firm, and that's kind of how you know you've done it correctly. Once you've got that, then all you're going to do is lift your hips up off the floor so that there's a straight line running from your knees to your shoulders where they're still laying on the floor. Okay, you're going to hold that for 5 seconds and then relax. Then you're going to go up again, hold it for 5 seconds, and then relax. Okay, and you're going to do that 10 times. Okay, and so that's the first part of your home exercise program. The next part is going to be what's called, we call them bird dogs, but basically you're going to go into quadruped position, keep your back nice and extended, and then do the same draw in. Okay, so you should bring your belly button all the way back to your spine, and then you're going to pick up one leg, and then one arm, and then the opposite leg. Hold it for 5 seconds, put it down. Then you do it on the opposite side. Hold for 5 seconds, then put it down. Okay, you're going to do that same thing 10 times, and you're going to maintain that abdominal draw-in. Okay, and then for the last part, I'm going to have you do prone press-ups. Since you seem to be a little bit irritable, what we're going to do first is we're going to have you do those on your elbows. And so basically you'll start off on your stomach, you get your elbows underneath you, and then you'll push up, and you're going to hold that for 30 seconds. Okay, and you should feel a nice stretch across your shoulders and then down into your lower back. And based on some of our tests, that should feel pretty good, and it should clear up some of the pain running down your leg. Okay, you're going to hold it for 30 seconds just on your elbows, and then you'll relax. And you're going to do that 3 times, 30 seconds. And so essentially, if you do that before you do any of your regular lifting routine, just as kind of part of your warm-up, that should kind of set you up for success throughout the exercise. That said, continue your regular exercise. Okay, don't be afraid of this. It's again not that big a deal, and will probably clear up. Just make sure that you maintain good form in all of your lifts, and don't do anything that causes you pain. Okay, a little bit later down the line, we'll start to address some of the specific lifting mechanics and try to make sure that this doesn't happen more often or more aggressively in the future. But that'll be after we've had at this for a little while. And so I see here that you're worried about kind of your age and already having back problems. It's kind of trite that it's not the age, it's the mileage. You're in a very physical profession, and so it's natural for you to be sore sometimes. And so this is not something that is debilitating or will break you off and make it so that you can't do your job anymore. We just have to teach you better ways to go about managing it while you're, say, in your truck, and then better ways to lift when you're going about picking things up and moving them around in the truck so that this kind of thing doesn't happen more often. And that kind of addresses your next issue too, is that will this happen again? It might. It's kind of a hazard of being in a physical profession, but we can kind of mitigate that and make sure that it happens less frequently by teaching you good strategies and good ways to manage it. It'll clear up in the meantime with a little bit of physical therapy and some dedication from you. In terms of other concerns, I see that you've got some relatively elevated blood pressure, and that you had already kind of identified that before, but it's something that you definitely need to talk to your provider about because it can be indicative of other things, and by itself can cause some heart issues. And so I'd like to call your primary care provider and talk to him about that, and we can go about trying to arrange a appointment for you so that you can get that seen to with your regular doctor. Otherwise, thank you for your time. I think this has been pretty productive. And is there any questions that you have regarding any of the stuff that I'm going to send you home with, or any of the treatment that's going to follow? All right. Well, you have an excellent day.